Hi friends, in this series of ECG Basics, today I will talk about U waves. First is a disclaimer. Caring Talks YouTube channel does not provide medical advice. Information available on this channel does not provide diagnosis or advice regarding the treatment. Information is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. U wave is a small deflection, usually less than 0.5 mm, immediately following the T wave. It is usually in the same direction as the T wave and it is best seen in lead V2 and V3. The source of U wave is unknown. Three main theories regarding its origin are delayed repolarization of the Purkinje fibres, prolonged repolarization of the mid-myocardial M cells after potential resulting from the mechanical forces in the ventricular wall. The features of the normal U waves are the U wave normally goes in the same direction as the T wave. It is inversely proportional to the heart rate. The U wave grows bigger as the heart rate slows down. U wave generally becomes visible when the heart rate falls below 65 beats per minute. The voltage of U wave is normally less than 25% of the T wave voltage. Disproportionately larger U waves are abnormal. Maximum normal amplitude of the U wave is 1 to 2 mm. Abnormalities of the U wave. These are prominent U waves or inverted U waves. Prominent U waves are described as prominent if they are more than 1 to 2 mm or 25% of the height of the T wave. Causes of the prominent U waves are bradycardia, severe hypocalcemia, hypomagnesemia, hypothermia, raised intracranial pressure, left ventricular hypertrophy, hypertrophic cardiomyopathy. The various drugs which can lead to prominent U waves are digoxin, phenothiazine, thioridazine, class 1A antiarrhythmics like quinidine, procainamide, class 3 antiarrhythmics, sotalol, amiodarone. Many of the conditions causing prominent U waves will also cause a long QT. Here in this ECG, we can see sinus bradycardia with prominent U wave. Here U wave is associated with hypokalemia. The patient's serum potassium is approximately 1.8 milliequivalent. The U wave is associated with left ventricular hypertrophy, U wave associated with digoxin use, U wave associated with quinidine use. Inverted U waves is also important abnormality. U wave inversion is abnormal in lead with upright T waves. A negative U wave is highly specific for presence of heart disease, and common causes of inverted U waves are coronary artery disease, hypertension, valvular heart disease, congenital heart disease, cardiomyopathy, and hyperthyroidism. In patients presenting with chest pain, here we can see the inverted U waves. They are very specific signs of myocardial ischemia. When U waves are present inverted, they may be earliest marker of unstable angina and evolving myocardial infarction. At times, inverted U wave they may predict more than 75% of the stenosis of the left anterior descending or left mean circumflex artery. Here in this ECG, we can see inverted U waves in patients with unstable angina. This is a patient presented with principal angina. We can see the inverted U waves. Patients with a non-ST elevation MI may have inverted U waves. The subtle U wave inversion in the later leads like lead 1, V5 and V6 in this patient, these were the only abnormal findings in the ECG. A good doctor's comforting and reassuring words are sometimes more powerful than medicine. Keep learning. Thank you.